Good morning. My name's Deborah Gail, and I recently had a complete replacement of my left knee, and I was looking for a means to improve my rehabilitation, and so I got involved with the RedCam and I started using it, and I found that the results were really quite miraculous. It was easy to use. It enabled me to put as much pressure on the knee as I wanted to without overdoing it. It enabled me to get a good bending moment without overdoing it. And from day one, I was able to get something like 200 repetitions, gradually increasing it up to about 600 repetitions. And within a month, I was not only back on my feet, but I was also driving my car. And the physiotherapists and the doctors were extremely pleased with me. I think that this is a very, very simple and wonderful piece of equipment to help with rehabilitation.
Hello, I'm Deborah Gail, consultant orthopaedic surgeon based in Lincoln, in Lincolnshire, and right from the onset of development of this device, the Lincoln RedCam, I've been involved in the design of the appliance. Its virtues are that it allows a patient to actually use their own muscle power in order to achieve flexion of the knee, extension of the knee, and they can graduate the resistance that they need using their own muscle power. I'm not in favour of the continuous passive machines, which tend to take all the work away from the patient and just passively bend the joint. It's ideal in the rehab of all lower limb problems, be they elective or trauma related, and I also think that with the patient's active mobilisation of the joints, it also helps to reduce or potentially reduce the risk of a thromboembolic disease in the leg, which is a DVT. It not only works on the joint, for example, a knee replacement, but it would also help facilitate the flexion of the hip and also the ankle joint as well. So my personal experience with the machine is I thoroughly recommend it. I think it's now come to fruition and that the design is complete and it's easily portable, and I think the patients will benefit enormously from its use.
I'm Keith Toll. I first got involved with this Lincoln RedCam device when in '99 I had a replacement knee joint in my right knee, and the recovery in those days there was no aid of any form to help recover and get the knee bending, and from that point onwards, being an inventor myself and having already achieved several patents, I decided at that stage it was time that I put my inventive brain to produce something that would benefit the recovery of total knee replacement surgery. We made several prototype models before we eventually came up with the present one, which I suppose you could say is now Mark IV, the variations and improvements that have been made over the years. And we have now arrived at a device that is really, really very simple, very effective, and it's been successful in my own case now. Having had 5 replacement knee joints in the last 10 years, I have tried and proved that this is a very, very useful piece of equipment which has given me a recovery in 8 to 10 days after the operation. I've been able to bend my knee to the full 90 degrees. And the last operation, in November '08, I'd had an infection in the knee joint for over a year, not been able to walk at all. And using the device when I got back home, it took me 3 weeks, longer than the original operations, but I'm now able to walk without the assistance of a walking frame or crutches, and that to me is absolutely fantastic.